today our topic of discussion is on the head injury. Let's discuss what is it. See, head injury is any trauma to the scalp, skull or brain. Okay, so let's discuss what is it. See, head injury is a trauma to the skull resulting in mild to extensive damage to the brain. Immediate complications include cerebral bleeding, hematomas, uncontrolled increased intracranial pressure, infections and seizures, changes in the personality or behavior, cranial nerve deficits and any other residual deficits depends on the area of the brain damage. Okay. Next, what are the types of head injury? See, head injury can either be closed or open. Open means penetrating. So here you can see there is, in the open head injury there is a penetration to the skull, whereas in the closed head injury there is no penetration to skull. Okay, so in open or a penetrating head injury means you were hit with an object that broke the skull and entered the brain. Whereas in the closed head injury means you received a hard blow to the head from a striking an object, but the object did not break the skull. Okay, so in the open head injury there may be a scalp laceration, fractures in the skull, interruption of the dura mater, whereas in the closed there may be a concusion, contusions, fractures. Let's discuss what are they. See, concusion. Concusion is also called mild traumatic brain injury. Okay, so the concusion is jarring of the brain. Jarring means violent shaking of the brain within the skull with a temporary loss of consciousness. Whereas in the contusion is a bruising type of injury to the brain. Bruising happens when the small blood capillaries ruptures. So the contusion is a bruising type of injury to the brain, and the contusions may occur with the subdural or the extradural collection of the blood. Skull fractures. Skull fractures may be linear, depressed, compound or comminuted. Okay. So next is assessment. How we can assess the head injury. See, assessment finding depends on the injury. Clinical manifestations usually results from increased intracranial pressure, changing the neurological signs in the client, changes in the level of consciousness, airway and breathing pattern changes. You have to assess the vital signs. For the signs of increasing intracranial pressure, patient may complain of headache, nausea, vomiting. Okay, so visual disturbances may be there, pupillary changes, papilledema. Papilledema refers to the swelling of both optic discs in your eyes due to the increased intracranial pressure. And extraocular eye movements will be there. Knuckle rigidity means neck stiffness. CSF means cerebrospinal fluid drainage from the ears or the nose. Weakness and paralysis will be there. Decreased sensation or absence of feeling, reflex activity changes, seizure activity may be there. Okay. Next, interventions. What are the nursing management? What you can do for the head injury? See, monitor respiratory status, maintain the patent airway, because increased carbon dioxide levels increases cerebral edema. Monitor the neurological status, vital signs including temperature, monitor for the increased intracranial pressure, maintain head elevation to reduce venous pressure, prevent neck flexion, initiate normothermia means normal body temperature measures for increased temperature, hypothermia may be there. So assess the cranial nerve function, reflexes and the motor and sensory function, initiate seizure precautions. Next, monitor for pain, restlessness, avoid administration of morphine sulfate. Why? Because it is respiratory depressant and may increase intracranial pressure. Monitor for the drainage from the nose or ears, because this fluid may be a cerebrospinal fluid. Okay. Do not attempt to clean the nose, suction, or allow the client to blow the nose if drainage occurs. Do not clean the ear if the drainage is noted, but apply a loose or dry sterile dressing. Check drainage for the presence of CSF. Notify the physician if the drainage from the ears or the nose is noted. Instruct the client to avoid cuffing, because this increases intracranial pressure. Monitor for the signs of infection. Prevent complication of immobility. So this is all about interventions. So today we have discussed about the head injury, its types, how to assess the head injury, and what are its interventions. Okay, thank you.